Our main treatment that we use here to treat OCD is exposure and response prevention. And that treatment really has two separate parts. So one part of that is the exposure part, and the second is the response prevention. And so just like OCD or obsessive-compulsive disorder has two parts. It has the obsessions and then the compulsions. And so when we are having patients complete exposure and response prevention, the exposure piece is having them face feared situations or objects or scenarios. And then after that is when the response prevention piece comes in, because it's having them do that without following up with their rituals. But if someone has contamination concerns, they may touch something that they think is dirty or covered with germs. That would be the exposure piece. And then the response prevention would be not removing their germs from their hands. Learning that this thing that I thought was really triggering, I can actually handle. So we'll have patients create a hierarchy where they'll go through and identify different either situations or objects or particular triggers that might be difficult for them. And then we order them based on our 0 to 7 scales. And then we'll have them move through that hierarchy in a very systematic way. We also like to make sure that they are repetitive. So we'll have patients do the same thing over and over again to really help solidify that learning that's occurring during the exposure and ritual prevention. And once they get the first taste of, I really can do this and I have the ability to do this, it's really cool to watch how quick they start to pick up speed and how quickly they can move through different exposures and get pieces of their life back.